Ladies and gentlemen, a very warm welcome to you. You're watching another episode of Encounter. Today we have Wahhab Korimboccus in the studios with us at the MBC. He's a doctor in alternative medicine. He is also a therapist in soutenons. Doctor, very warm welcome to you, and thank you for being here with us.
Thank you very much, Roshan. Thank you very much for giving me this opportunity to be in the studio just to explain a bit the medicine which I'm practicing.
Well, it is all our pleasure because Encounter is all about giving a platform to people to introduce what they do, what they practice to make society a better place to live. Exactly. First things first, two questions. What is alternative medicine and what is soutenons? So let's start with alternative medicine. How is it different from someone who has studied, a doctor who has become a general practitioner and then specialized in a certain field? You're a specialist in alternative medicine.
Exactly.
So can you please elaborate a bit more about?
Yes, actually, when we talk about medicine, this is medicine which is practiced in hospitals and which everybody knows, whereas alternative medicine is all the different types of treatment that is being given, and it includes Ayurvedic medicine, it includes homeopathy medicine, chiropractic, and you can just keep on going with a very long list. And these are alternative medicine.
The treatment that you dispense to people does not include drugs, and it's all natural treatment.
Exactly.
So it is guaranteed that there are no side effects.
Exactly. Actually, the medicine which I'm practicing, it's a Korean medicine. It's called Onuri medicine. Well, Onuri, it's a Korean word which means universal.
How do you write?
O-N-N-U-R-I.
Okay.
Onuri medicine. And under this Onuri medicine, there are several therapies which fall under it. And the main therapy is called soutenons therapy. And most probably this is on what we are going to talk a bit more today.
Exactly. So I'll just point out that in terms of as a soutenons therapist, you're the only one who practices it in Mauritius.
Exactly.
What is so different with the soutenons?
Well, soutenons, you know, it's a Korean medicine. It's a therapy in which you use points on the hand and the feet. By the way, su means hand in Korean language, and jok means foot. So you work on the points, on the hands and the foot.
Oh, fantastic. So does it mean that you're able to have a reading of a person using the hands and the sole of the feet?
Exactly, exactly. Actually, you know, if we look at our hand properly, maybe we're going to see it clearly now. You see that there are 5 projections.
Of the 5 fingers?
Of the 5 fingers. And if we look at our body, the trunk is here. You've got 2 hands, 2 legs, and 1 head. You have the 5 projections. And all these are found on the hand. Now, if we look closely at the thumb...
Is it the head?
Exactly.
Okay.
You will see that there are only 2 moving parts on the thumb.
Yep.
So this is going to be the head, and this part is the neck. Whereas the others, this is going to be the right hand. Yes. This is going to be the left hand. These 2 are the 2 legs.
Okay.
Right leg and left leg.
So you're using your right hand to explain this?
Exactly.
Okay.
So like this we have, in other words, like the professor who invented that medicine said, our Creator loved us so much that He created us with 4 clinics. And the 4 clinics are the 2 hands and the 2 feet. So with the 2 hands and the 2 feet, we can treat all diseases. Of course, we have some limitations in all medicine.
So the reading that you can do can be done on either hands or on either foot?
Exactly. Yes, yes, yes.
I'm very impressed because it sounds a bit like a reflexology and pressure points to me. So
yeah,
is it the same thing or is it different?
No, not at all. It is completely different. Because if you have a look at this hand, for instance,
yep.
If you place the thumb in this position, you will see that this is head and neck. This is the whole body.
The trunk.
The trunk. And these are the 2 hands and the 2 legs.
Of course.
Now, there are 2 ways of looking at it, depending on the problem that the patient is presenting. So this is the original standard position. Okay, and if I put the hand like this, this is the upright position. For all problems below the diaphragm, we do this standard position. And for all problems above the diaphragm, we do this upright position.
Why is it? Why do you have to do this? This is a bit complicated, but yes.
Okay.
Please walk us through it.
Exactly. So if I do like this, you will see that this part of the hand is a bit thick.
Yes.
Now, what is the reason for this thickness on the palm? Exactly, this is what I'm going to explain.
Yeah.
Because there is an overlapping of organs here. These two parts here, these two parts, they represent the lungs.
Okay.
And here, this part represents the heart.
Okay.
So, as you can see that you can, in this position, you can localize very easily those organs, the lungs and the heart.
So if I'm having pain in my lungs or I'm having a heartbreak, I can massage those points, it will help?
Sure, you
Is
can
that
do that
scientifically proven?
Yes, of course. Of course, it has been proven scientifically. And by the way, you know, the sujok therapy is being recognized by the World Health Organization.
Okay, tell us more about the sujok therapy. When was it invented? Who is behind it? And how has it progressed over the years? Give us a little bit of history.
Exactly. Sujok therapy, it's one of the therapies falling below the Onyuri medicine, which was written by Professor Park Ji-woo. Professor Park, he is Korean, and he was working in Russia at the time when he did all his research work and he wrote all his books in Russian language.
But he's Korean?
He's Korean.
Okay.
And he was working there, he was a doctor working in Russia. After writing all these literature and so on, he started teaching it to his colleague friends, colleague doctors. Okay, so it started just like that, and gradually, and by the way, it is good also to mention that during that Chernobyl disaster, Professor Park, he did lots of work to treat people affected by these radiations.
Yeah. How did it feel when you realized that the whole body is replicated in either of the hands or the foot? Was it like a eureka moment?
Actually, I don't know whether you'll give me this opportunity to explain a bit to you how it happened that I discovered sujok.
I'll give you the opportunity, but in the meantime, I'll invite you and the viewers of Encounter to watch this following video on alternative medicine and a little bit more about sujok. And when we come back, you'll tell us how you found this. The human body, a form of life, is a tiny, well-harmonized universe on its own. It has everything needed to exist in nature as an integral and independent phenomenon. Man has the inherent ability to establish, maintain, and restore health. It is our ultimate purpose to do so, to establish a good, healthy life on Earth. Health and disease are conditions of the whole organism involving a complex interaction of physical, mental, emotional, genetic, and environmental factors. Natural forces within us are the true healers of disease. Sujok therapy, founded by Professor Park Ji-woo of Korea, is a complete healing science which emphasizes that the power to cure yourself lies within you. Nature provides for and helps us to maintain a healthy life. It teaches us the lesson of the spirit of independence, to actively help in elimination of the disease ourselves. Sujok therapy attempts to bring in everyone the realization that the spirit of love resides within each of us, in our hands, in our feet, hence giving us the universal power of healing. Sujok therapy, a method of treatment by stimulation of hands and feet, is easily one of the best self-care methods. It is highly effective, instant, and totally safe without any side effects. Accessible to everyone, it is logic and reasonings make it simpler to master. Sujok therapy uses a combination of physical, metaphysical, and transcendental treatments to heal the diseased state of specific organs, zones, meridians, and the mental and emotional states of an individual. It is a natural healing science without any inculcation of drugs. Ladies and gentlemen, welcome back to MBC. You're still watching Encounter, and we still have Dr. Wahhab with us in the studio. before we watch this video, you mentioned that how it has been interesting to you, and I asked you, how did it feel when you discovered that we have 4 clinics in our bodies? But probably tell us a bit more about your journey. How did you discover sujak therapy? And how is it so interesting when you found out about it?
Well, exactly. I was in India at the time. I met one of my friends. We were studying at the university together. By the way, we did our physics degree together. And I was asking him about his parents, how they are and so on, because I've been knowing them. He was telling me that his dad was having some problems with his teeth, and even his brother, neither his brother nor his sister could treat his father. Both were dentists. And I said, what happened then? He told me there is someone who is practicing a therapy called sujak therapy. I said, sujak therapy? I never heard about that. He told me, okay, that's why I'm telling it to you, because I know you are interested in alternative medicine. I'll take you to that therapist. So one day we went there. He was receiving his patients. I introduced myself. He allowed me in his clinic. And I was watching him. A lady came in with lots of pain, lower back pain. He asked the lady to sit down and started to work on some points on the hand. And after hardly 1 minute, he started asking that lady, how are you feeling? How is the pain? That lady started to move and said, yeah, it's getting better. He asked the lady to stand up and move. That lady was moving with ease. I was so impressed, and at the same time I was asking myself, is he not fooling me?
Yeah,
to be frank.
It was instant relief.
Exactly. Then I asked him, but is it okay? Is she fine now? He said, yeah, this is a magic treatment.
It sounds magical.
Exactly. Then I was so impressed. I told him, you know, I've been doing all these alternative medicine and so on. I've been practicing acupressure, acupuncture. I told him all that I was practicing. He said, okay, I think you're going to love this one. I'll give you the address and you can write and just get to into that course. Exactly. So what I did, I just wrote a letter to that institute there. At that same time, I was traveling to the States. So
how long did those studies take to complete?
Well, sujak therapy, you know, they give it in different parts. They have 3 levels, and these 3 levels, it goes on hours of course.
Of course.
The first level, it's a 4-day course, full day course, and it's the basic level only. Then you have level 2, which is advanced level. This is getting into more complicated. You have acupuncture and everything on the hand with small needles. Then you have level 3, you have energy system of the hand, of the body, and so on. This is very complicated. So it takes quite some time to master this medicine.
What are the prerequisites to be able to follow such a course?
Well, actually, they require a degree in science to start doing that course.
Okay.
Yeah. But of course, you can even train someone. For instance, Roshan, if I want to show you some points, you're having headache, for instance. I can ask you, Roshan, press some points on the thumb. Or you're having some tooth problem, press some points on the thumb. Okay, so like this, I can show you some points, and you can start pressing on the points to treat yourself. But this is, of course, not a full treatment that you can give to people.
It's part of it.
Yeah.
So this falls nicely onto my next question, because you work with back pain, you work with people who suffer from cholesterol, diabetes. I mean, you name it, any non-communicable disease or any physical pain that people are having. Is it true that you're able to help them and treat it?
Yes, of course. And the result, you know, it's amazing.
I wanted to ask you that also. How do you compare the results from traditional doctors to those who come to you for alternative medicine?
Well, to be frank, Roshan, you know, there are lots of doctors from the normal medicine. They come to me for treatment, and they are very much satisfied with what they are getting. And especially, they are not taking any medication.
So you saw that doctor in India, and you were very impressed that he could help a person get instant relief.
Exactly.
So was it the same feeling when you treated your first patient in Mauritius?
Yes, of course. And it was not in Mauritius anyway, because it was in India.
You had
I did my studies, I had to practice there. I was so amazed. And each time that we meet friends for some seminars or whatever, we just ask each other to do a checkup with us. And you know, the full body checkup, it takes hardly 2 minutes. And the full body checkup, it's genuine. There is no error in that.
Coming back to my earlier question, what is the main problem that people come to see you with?
Well, you know, people, they would come to me mostly for pain.
Physical pain.